problem with healthcare in America is not the quality. The quality of healthcare in America is the best in the world. That's why you see when somebody overseas gets sick and they got enough money, they come to the United States. It's the cost of healthcare. But my top priority, my top domestic priority, is to give our veterans the health care they need and deserve, and they're not getting today. We all know about what happened at Walter Reed. We know the disgrace there of a facility that had that our men and women who are serving in the military were living in deplorable conditions. It was a disgrace, and it's got to be fixed. And I tell you, there's an argument for having people who served in the military in the Congress today, because following that, they convened a convention headed by Bob Dole, a great war hero of World War II, as you know, Donna Shalala, former Secretary of Health and Human Services. They came up with legislation, recommendation. We turned it into legislation called Wounded Warriors to fix a lot of these problems. Do you know I stand here before you today and tell you that Congress has still not passed that legislation? Still not passed that legislation to help repair the medical facilities, the needs, the disability adjustments and adjudication. Disgraceful. Maybe if we had a few more people who know what it's like to serve in the military, as a lot of brave Americans sitting in front of me have, that maybe we would have gotten that legislation done. But I want to tell you that this war, my dear friends, is going to put an additional strain on our veterans' health care system. It's just a fact. There are many thousands who are coming back wounded, and thank God we have so many coming back. We are able to bring people from the battlefield to medical care in the most rapid fashion, and we've saved so many lives that we wouldn't have been able to in other wars. But that's also going to put an increased strain on our veterans' facilities. My friends, we need to expand the VA, but we need to focus on PTSD, on combat-related wounds and burns, and those things that the VA is best at treating. But there's also this huge problem. Today in Phoenix, and probably here in South Carolina, in many VA facilities, the veteran is coming in that needs some routine health care, and he's standing in line. There's probably not a place to sit down. He's getting an appointment to get an appointment. You know that, Jerry. And they're not getting the health care they need. Here's a simple solution, my friends, and I'm going to do it. I'm going to give every veteran a plastic card. And they're going to take that plastic card, and if they don't want to go to the VA to get that health care they need, they can go to any health care provider they can find and get it immediately. Congress spends money like a drunken sailor. Only I never knew a sailor, drunk or sober, with the imagination of Congress. That's kind of a cute line, and I use it all the time. I'm not making this up when I tell you about 6 months ago I received an email from a guy. I'm not making this up. He said, and I quote, "As a former drunken sailor, I resent being compared to members of Congress." I promised we'd be careful stewards of their tax dollars. My dear friends, I'm going to fix it. I've got an old ink pen that Ronald Reagan gave me many years ago. This isn't it. And I will go around, and every pork barrel bill that comes across my desk, every year, Mark, I will veto them. I will make those people famous. You will know their names, and we will stop it. We will stop it. And we will stop that wasteful spending, and then we're going to move on and do the hard things. And that's fixing Social Security and fixing Medicare, which are broke. And I'm not going to hand that responsibility off to another generation. We're going to fix it. We're going to fix it as patriotic Americans. Let me just...